Hello, I'm Kate Warren, Executive Vice President Devex, here to talk about an important but often overlooked aspect of the COVID 19 pandemic: access to family planning. I have no better expert to speak on this topic than Bayer Pharmaceuticals Global Head of Market Access, Public Affairs, and Sustainability, Dr. Klaus Runge. Klaus, thank you so much for joining us today.
Thank you, Kate. Pleasure to talk to you today.
Right. Well, so much of our audience may be very well aware of this stat, but for those who aren't, there are some 200 million women who want access to modern contraception and can't get it. This is an issue you at Bayer have been at the forefront of combating, even committing to help provide an access to contraception to 100 million in lower and middle income countries by 2030. So half of that gap. Both of those are pretty staggering numbers. But from your perspective, Klaus, why is family planning so essential, particularly in low and middle income countries? And what impact has this pandemic had on access to services?
Thank you for the question. And let me start by addressing the topic of family planning to start off with before we get to the pandemic and its consequences. So, Gender inequality remains high, and teenage pregnancy and maternal death are serious health concerns, especially in low and middle income countries. And in fact, the United Nations estimate that by expanding access to family planning services, tens of thousands of lives could be saved every year. And family planning is not only a human right, it is also central to women's empowerment. It is helpful in reducing poverty, protecting maternal and child health, and driving economic development. And by this, it can help achieve the sustainability goals that we all have on mind and on the agenda. So, as you rightfully said, more than 200 million women in developing regions who would like to avoid pregnancy are not using safe and effective family planning methods. And the reasons for that are very diverse and multiple. So, it includes lack of access to information or to services or lack of support from their partners or their communities. And if you shed a light on it from an economic perspective, uh, family planning and every investment in family planning is a highly effective means of development aid. So the Copenhagen Consensus Center, for example, estimated that every dollar invested in family planning activities will generate long-term benefits worth $120. So that's significant. So that is, let's say, the general framework that we're working on and dealing with in the area of family planning. Now, the question is, what has COVID-19, what has the pandemic done in this situation in our context? And I think it's fair to say that the pandemic has even exacerbated existing inequalities between women and men in many societies on this globe. Um, in particular, we feel that especially women, and in particular those who are marginalized and poor, face greater difficulties protecting themselves from transmission due to lack of information, resources, access to quality health and social services than prior to the pandemic. And I think the rights of these women need to be at the forefront of our thinking and to really be able to help community cope with the situation, we have to make sure that they don't fall back into old patterns where they resort into negative mechanisms such as child, early and forced marriages. We've also seen rising, skyrocketing, sometimes even levels of domestic violence. And I think that the denial of women and young girls' health, rights, and socioeconomic prospects should not be uh, uh, left unaddressed, so to say. So, in some cases, we've seen that policymakers have even considered the provision of contraception services to be non-essential during the pandemic. In other words, service providers, hospitals have stopped offering these means to women in order to be able to shift more resources and services to the fight of the pandemic. So that has led to an acceleration of the problem with many women not gaining access to family planning services any longer. And I think it is dangerous to push family planning to the sidelines in this pandemic because the implications are far-reaching when you again think about maternal and child health or the economic well-being of entire communities. And finally, most of the healthcare workers fighting at the forefront are women, if you look at it in low and middle income countries in particular. So I think the pandemic has really worsened the situation that we're talking about.
Yeah, and so you talk about just it being classified as non-essential services, so just lack of access in some clinics and other places, maybe diverting resources. What are some of the other challenges you at Bear face in helping women get access to contraception? We've heard of obviously people might be afraid of going into a clinic, afraid of catching the virus by leaving their home. Are there market supply issues? What are some of the other challenges that you all are facing?
Well, there's multiple challenges. So on the one hand, as you rightfully say, women in search of family planning services may have been worried in the pandemic to go to service centers, to use transportation services, et cetera. There also have been, let's say, global supply constraints when it comes to offering material that women actually need. Um, so this has also put healthcare systems under significant stress. And finally, we have also seen that members of the global donor community have pulled out of family planning service financing, which has led to significant gaps for those who actually serve as vendors and distributors of these services and products. So I think that's another big concern that I have, that for good or bad reasons, for the right or the wrong reasons, the community has refocused and sometimes has let family planning aside.
Yeah, no, I'm based here in the U.S., where obviously our government has slashed funding. I think back in April, UK slashed funding to UN Population Fund by 85%. As you say, the needs are actually increasing and the funding's decreasing. I want to talk a little bit about how public-private partnerships can help play a role here. And I think in this past year and a half and some change we've been living through this pandemic, we've seen private and public partnerships come together perhaps more than they ever have before. I know last year, an event with you on Bear, you announced a partnership with UNFPA that I'd love to hear a little bit more about. But what do you see as the respective roles of the public and private sector, and how can they best collaborate to help overcome some of these challenges in providing access to sexual and reproductive health for women and girls?
Yeah. So let me first again go back to the current situation that we're in. So as we briefly hinted to, the UK government has slashed its funding by 85%, which is a big hit to agencies such as UNFPA. So I think it's a tense situation that we're all in with this step. The good news is that others are ready to step in. So we've seen the French government is ready to close that gap with a contribution of roughly $100 million. We see that some of the philanthropists, so the Bill and Melinda Gates Foundation, have said they would be ready to inject more funding into it. And also, we as a company, we have decided to do A, donations, and B, product and kind donations to UNFPA supplies partnership. So all in all, it was worth like 4.3 million US dollars. So, and I think these it's important to keep in mind that these numbers translate into, or these figures translate into people's lives touched. So with the donations that we as a company do alone, we will most likely be able to prevent 215,000 unintended pregnancies, probably 5,000 maternal and child deaths, and more than 50,000 unsafe abortions in countries such as Congo, Ethiopia, Lesotho, Papua New Guinea, Yemen, Zambia, Zimbabwe, etc., etc. So I think whenever we talk about funding, we need to understand what is behind those numbers. And you're right. Uh, Apart from making sure that that there is enough means available to to support the programs and supply, we really need partnerships. And I think the pandemic has more than ever shown that even more non-traditional partnerships can help solve for some of the burning issues that we have. So, and this is something which probably has been one of the major learnings of the pandemic. So, we are glad that we have jointly identified ways of reaching the most vulnerable in the world together with UNFPA as a company. We have also been able to continue to supply our product despite the pandemic to UNFPA and other institutions. And we're glad that we have also been able to expand the range of product offering that we can give to those supranational institutions. So we have an intrauterine system that for the first time has been listed and included into the product offerings, which really has been a big step, not for us, but also for the end user. So, in other words, we look forward to continued great partnership with UNFPA and others to support women in low-income countries with the family planning options they need, and thereby increase gender equality.
Yeah, great. And, so as I mentioned earlier when we first started, that you have committed to help provide access to contraception to 100 million women in lower middle income countries by 2030. I'm sure that is a commitment that's becoming even more challenging to reach. But how are you going to reach this goal and kind of keep that high target? And as we are, rapidly racing towards 2030.
Yeah. So first of all, I think modern contraception needs to be affordable, needs to be accessible and affordable. So together with our partners, we can work on the accessibility of our product, the availability in terms of supply, and we've really done our homework in this regard. We have upgraded our core production facility, Turku in Finland, with an investment of roughly 300 million US dollars, so that we really make sure we can increase the output and really make sure that there is sufficient supply to gradually come to the number of 100 million women that we want to have gaining access to services and products. So that is one step. The other one is really affordability. I mentioned that briefly. We also have introduced different pricing mechanisms worldwide so that we can make sure that people in poorer countries will have to pay a way lower price for the products that we offer than, let's say, industry nations. So that is another point. So the way we price our products and the way we make sure that supply is sufficient to reach those in need. There is other elements that we are working on. We all need to jointly work on social norms, on the revision of some of the gender stereotypes, because they can also represent major hurdles to family planning. The other part I want to refer to is capacity building, and that is something where we try to work with partners to help develop knowledge, skills, structures, systems, leaderships in the markets, in the countries that are in scope of the 100 million changes. So there's many challenges that we face, but again, I think I do firmly believe that through partnerships we will be able to overcome some of those significant barriers and to reach more women.
Great, thank you. Well, we look forward to continuing to cover the good work that you are doing and others are doing on this important topic. But thank you for taking a few minutes to share with us today about your experience.
Thank you very much. The last thing I would like to refer to is the challenge initiative that we haven't touched upon during this discussion. It really is a great global initiative which is spearheaded by the Johns Hopkins University. And we've heavily invested into this program as a capacity building program to make sure that the help communities need, especially in informal settlements, is really granted to them. It has already supported access to family planning for over a million women in East and West Africa, India, and Philippines, and it continues to grow. And we're committed to support the Johns Hopkins University with this project over the next few years. So, with this, thank you for the opportunity to talk to you, and
Great.
yeah, have a great day. Thank you.
All right. Thank you.